On social media, we would like to know from you, what does being fearless mean to you in your everyday life? But for now, let's get the show on the road. We are honored to have oncologist Dr. Langenhoven with us to share vital information on breast cancer. Doctor, thank you so much for joining us.
Thank you, and thank you for having me today.
I love the month of October for a variety of reasons. It follows Women's Month, #1, but also it brings so much information, knowledge, and education to breast cancer awareness. And hopefully a lot of us know that early detection is key. Can you please unpack what exactly is breast cancer?
In our country, it is still the most frequently encountered cancer in all women. So we at this point, we believe that 1 in 8 women will develop breast cancer in their lifetime.
Okay, which means that information around this is key, right?
Absolutely. For me, Breast Cancer Month is where we take the hands of the women we love. We go to the mammography center together as a group of friends. We support each other. We don't know what the outcome might be, but we go together and we make sure that we do it for ourselves, for our families, and for the women that follow on us. So
yes.
I have a 4-year-old, and part of taking care of her is taking care of myself.
Yes.
So when I go for all of us, and I take the woman I love with me to make sure that if something were to be detected, it would be early, because small tumor, small problem, small treatment. You see, and I think that's what a lot of people don't understand. If you were to catch something, even if it's an aggressive cancer, at a very early stage, we can de-escalate treatment. So we could potentially forego chemotherapy for some women. We could potentially forego disfiguring surgeries for other women. So the diagnosis would be made regardless. So people fear mammography because they fear the diagnosis, but the point is, if you were to pick up something that is a few millimeters in size, the treatment is so different to something that eventually becomes apparent.
Yeah.
So it's about the de-escalating of our treatment options, and that's why mammograms are important.
Yeah, they're vital. So, Doctor, can you tell us about the various types of breast cancers that are out there, and then is there one in particular that is most prevalent in South Africa?
So at this stage, we understand that there are at least 4 types of breast cancer.
Okay.
The first 2 types grow on the female hormone, and these tend to be the most prevalent types, and usually a bit in our older women, and they are also associated with the use of hormone replacement therapy. For these types of cancers, sometimes we get away with just withdrawing hormones, whereas sometimes we actually do need to add chemotherapy to the treatment. And then you get 2 different types, which we do see as more aggressive, and chemotherapy is always used in these types. So they're the HER2 subtype and the triple-negative breast cancer subtype. So the HER2 subtype actually is a well-understood type of breast cancer. And here we see complete responses often even in disease that has spread, because we understand it so well.
Okay.
I have quite a few women in my practice who presented with metastases to the liver or the brain that live a normal, healthy life now, free of cancer. In terms of the triple-negative type, what it means is 3 times negative. So the receptors we look for are the female hormone receptors, the estrogen and progesterone, and the HER2.
Okay.
So those are really the subtypes that's how we know what subtype you have. We do a biopsy and we check for those 3 receptors. So if you have the female receptors, we then focus on the female hormones. So we withdraw that as the focus of your treatment.
Okay.
If you have the HER2 subtype, we focus on blocking the HER2 and the addition of chemotherapy. But if you do not express or use any of those receptors, we actually do not know what the cancer needs to grow. So it is 3 times negative.
What are the symptoms that
of
one
breast
needs to look out for?
So hopefully nothing. If
Okay.
you go for your mammogram, the symptoms should be nothing. You should pick up something before you can feel it, before you know it's there. The smallest cancer I've seen picked up at our unit was 2 millimeters in size.
Okay.
2 millimeters. I mean, you just cut that thing out and you chuck it. That's the end of it, you know. So hopefully if you go for mammography, the point is that we pick up something before it becomes apparent. But if we do miss that opportunity, things that we can look out for is usually painless swelling.
Okay.
A lump, in other words, in the breast. The earlier signs are just a lump, but as the lump enlarges, it can cause pressure on the skin, or it can cause pulling of the skin, and it can look like an orange peel type of skin.
Okay.
Often women will stand in front of a mirror and brush their hair or lift their arms to get dressed, and they notice an asymmetry in the breast. So a pulling type notion can also alert you to the presence of breast cancer. The other thing is a painless lump under the arm, so an axillary
to test
lymph
under your
node.
armpit as well.
Yes, and also your breast actually extends all the way up to under the arm, and then you have lymph nodes sitting just adjacent to that. And then there is, unfortunately, a more aggressive but seldomly seen type of breast cancer where all of a sudden the breast becomes inflamed, hot, sore. It actually looks like an abscess or a big inflammatory process, and that's an atypical way of breast cancer to present. But if that were to happen to you at any given point in time, regardless if it's cancer or an abscess, you actually need to get to the doctor soonest.
Doctor, thank you so much. I guess what you're saying in a nutshell is go and get screened, go and get tested. What age should we start, before we wrap?
So for a general population, the answer differs to a genetic family with high risk features. So general population, we say that every woman should have the choice to start at the age of 40.
Okay.
And for high risk families, so if you're aware that your mom had breast cancer, your aunt, we would say 10 years younger than the youngest person affected.
Okay.
So if your mom was 30, you need to start at 40, you need to start at the age of 30.
Okay.
But also in that case, I would recommend that you do seek the help of a genetic counselor, because we can actually prevent breast cancer from happening, and we can prevent the complications of breast cancer. So there's a lot that can be done.
Thank you. Thank you so much, Doctor. Thank you for enlightening us in all this information.
Thank you so much for the opportunity.
Remember, staying informed and vigilant can make an absolute life-saving difference to your life. Stay tuned, because after the break, we chat to breast cancer survivor Lauren Yappy.